So we've addressed ankle mobility, we've addressed hip mobility. What else is required to sink into a functional squat, a strong functional squat with good form and good technique? A big part of squatting is learning how to squat with an organized, stable spine. What does that look like? Looks like this. I'm bending forward at the hips with a straight back. I'm pretty much keeping my spine in a neutral position, so I've got a slight inward curve of my lower back, I've got a slight outward curve of my upper back, my head and neck are in line with the spine, so everything's nice and neutral. That's a nice organized position of the spine when I'm squatting. Compare that position to this position where I'm rounding. I'm rounding the lower back, rounding the upper back. Shoulders are rounding. This position puts a lot of strain on your lower back and can lead to excessive wear and tear and injury. So you don't want to be here. You do want to be here. How can we work on this? I think it's easier to work on this in sitting. If we work on this in sitting, and I'm going to turn sideways here so that you can see what's going on, then you get a sense for what this feels like. The first thing I'm going to have you do is just place your fingertips in the hip crease. The hip crease is where our hips bend, and you can sink your fingers into that hip crease regardless of how big your belly is. And once you're here, I'm going to have you do a couple of things. The first thing I want you to do is round the back. Round the back. And this is that core posture that I was talking about. Rounding the back is a weak position for a squat. And then notice what's going on in the hip crease where your fingertips are positioned. Really not a whole lot. But if you compare that to bending forward at the hips with a straight back, now you're going to feel those fingertips getting pinched off. And they're getting pinched off because the pelvis is rotating forward and the hip bones are pressing on your fingertips, creating quite a bit of pressure that you can easily feel. So that's what I want you to work on in this position. I want you to work on just tipping forward, keeping the spine straight and organized, and feeling the pressure on your fingertips. Go back and forth a few times. Maybe you're even contracting your lower abdominal muscles, keeping the core nice and tight. That will help keep the spine organized. So maybe you're actually drawing the belly in toward the spine and using those core muscles to support and stabilize the spine. When you get really good at that, you won't need your fingertips in the hip crease. You can do things like reaching forward or reaching up as you tip forward. Another thing to keep in mind is this relationship between the lower back and the pelvis. When we're tipping forward this way, the pelvis and the spine, if this is my pelvis and this is my spine, they're really tipping forward together. When you're rounding the back, this is what happens. My pelvis and my spine are out of sync. When I'm doing this properly, I'm tipping forward, spine and the pelvis are working together. And you can feel that happening. You can feel this forward tipping of the pelvis by placing your fingertips right at the top of your tailbone, or really anywhere on the tailbone. So find your tailbone. You can even find the tip of your tailbone. That's easy to find. And when you tip forward, you're going to feel the tip of your tailbone peeling up off the seat. That tells you that the pelvis is tipping forward. And when we're sinking into our squat, when we're practicing stability of the spine in this position, we want you to feel that tipping forward of the pelvis. So that tailbone should be peeling away from the chair. When we come back to our upright position, you're going to feel the tip of the tailbone sinking back into the chair. So take a moment to feel that now if you haven't done that already. Let's put everything together, because now we can put all of those movements together into exercises that actually look like a squat. A really nice position to practice our squat is over here by the wall, because I can support myself with the wall and work on some of these principles. When you're getting set up over here by the wall, you're going to start off here, lean up against the wall, and slowly walk your feet out. Keep your feet nice and wide, about hip width. If your feet are nice and wide, you're going to feel more stable and secure against the wall. Some people have a fear of your feet sliding out from underneath you when you're in this position. And that's not going to happen. Your shoes are sticky enough on this carpet where you're going to be okay. You're going to be safe and stable and secure practicing our wall squat. Feet hip width apart, and then from here it's really just a matter of sinking into our squat. Right now, all I want you to do is practice going down a quarter of the way. So I'm sliding down on the wall, pausing for a moment, and then pressing myself back up. Let's do that a few times. Feeling the weight of your body sink into your feet. Two more times. And let's talk about some of the finer points with our wall squat. Really the first thing to pay attention to is how far away your feet are from the wall, because this is what I see most often. I see feet that are too close to the wall. And when I sink into my squat this way, now my knees are coming way out over my toes. If I look down, I can't even see my toes. And that puts a lot of stress on the knee, especially the patellofemoral joint, the joint formed by the kneecap and the femur. So make sure your feet are far enough out so that when you sink into your squat and you're only a quarter of the way down, you can still see your toes. If you can't see your toes, your feet are too close to the wall. The other thing that I want you to pay attention to is the position of your knee medially and laterally. That's the side-to-side position of your knee. A very weak position for your knee and for your squat happens when your knees drift together this way. So when my knees drift together, my feet turn in, they flatten out.